Great. Perfect. You read my mind. Welcome everyone to this very important conversation about Girl Scouts and in-person activities. I thank you all for joining us. And for many of you who provided us some pretty wonderful questions that have helped to format tonight's discussion. So thank you all for participating in that. We will get to as many of those questions as possible. If there's a question that we are not addressing, please put it in the chat and we will do our best to address those questions. Any questions that we are not able to address, we will try to put together an FAQ to be able to send out to you after this presentation. We are also recording this presentation and tonight's discussion. If you do not want to be on the recording, please take yourself off of camera so that you're not included. But we will be recording this presentation so that you can look at it. We hope to get it up onto our website the beginning of next week. So if we could go to the next slide, Allison. And next slide. My name is Carol Dedrich. I am the CEO of Girl Scouts San Diego, and it is a pleasure to be with all of you tonight. This is our agenda tonight. We're going to do introductions of our speakers. We're going to give you some data and insights on girls' mental health, an overview of the in-person gatherings and girl opportunities, which again, were guided by your questions that you sent us in this week. We will have members of my team, Michelle Molan, the Chief Mission Delivery Officer, and members of the Health and Human Service Agency, as well as the Office of Emergency Services will be a part of this discussion. We will do a question and answer at the end of this conversation. And again, we have many questions that we're going to try to get to. If there's other questions that you have, please, please, please put them in the chat. So without further ado, let's get started. I would like to take a moment to introduce our speakers tonight. From the County of San Diego, we have Yael Koenig, who's the Deputy Director of Behavioral Health Services, Children, Youth, and Families, County of San Diego. Gary Johnston, Chief Resilience Officer, Planning Lead for Reopening, OES, County of San Diego. Elizabeth Bustos, Community Development Liaison, County of San Diego. And Michelle Molan, the Chief Mission Delivery Officer for Girl Scouts San Diego. I just have to say, this is a powerhouse lineup. I am so excited to have had the opportunity to get to know these extraordinary women and men who have worked with us to pull this together as quickly as possible to be able to provide it to all of you. So let's get going. We have a lot of content to cover. If we can go to the next slide. I would like to start out with Yael Koenig and Dr. Laura Vlegels. And Yael, if you can please help us understand the vulnerabilities of our girls and how parents can help them best manage and possibly build their resiliency, especially during this time of remote schooling and with limited access to activities and their friends. And I'm going to turn this over to you. I know you have a PowerPoint to go over with us. So if you can bring up the PowerPoint and let's bring Yael.
Thank you, Carol. I'm working on it. Let's see how it works. Okay, fantastic. So when Carol and her team reached out, they asked for some very important information for our behavioral health team to share with all of you. We have a pretty detailed slide set. I'm going to go through a lot of this information rather quickly, and Dr. Vlegels is going to really focus on the things that matters most, which is how do we support the girls always, and especially in the context of a pandemic. You may know that the county as a whole has a vision. We've been operating under this vision for over 10 years of really ensuring that all 3.3 million residents of San Diego are healthy, they're safe, and they're thriving. The first slide we're going to look at is a hard slide. It's difficult. We're going to start by talking about suicide and loss of life, and specifically for our girls and our girls that are under the age of 18. There's a lot of information out in the mainstream media and concerns and hypotheses that the pandemic is impacting the rates of suicide and increasing the rates of suicide. We wanted to share this information and show you our local data for San Diego County and really kind of give you a 9-year trend of what we're seeing as far as loss of life. So in the past 9 years, we've lost 21 girls to suicide, and you see that up at the top here. Most of the girls have lost their lives through hanging. And then there is the use of drug and medication. Those are the top means in which the girls have lost their lives. Here on the left bottom sphere of the slide, what you see is the loss of life of our girls year by year. And what you see is that back in 2012, we lost 2 girls. And over the years, there has been 2019, we were at an all-time high with loss of life for 4 of our girls. In 2020, the data is back down to 2. We've lost 2 girls lost their lives. So this is really important because we know the pandemic really started in March of 2020. So as you read information in mainstream media, just remember this and some other information that we're going to share with you. It really takes a bit of time for the data to catch up and inform us. And Dr. Vlegos will talk about that. So we want to be cautious about what data sources we use. However, we intuitively know that our girls are struggling during the pandemic, and we're going to focus on some things that we can do to support them. We also wanted to let you know that our boys, we're also losing some of our boys to suicide. So just included that for your information. And as our kids age, when we enter age 18 to 24, we are seeing an increase in loss of life. And that's really important because the foundation we create with our girls really support them throughout their adulthood. And suicide is very real for all of us. The California Healthy Kids Survey is one of those very reliable data sources for California. It's collected every 2 years, so it will be collected soon. And what you see here is that we are seeing an increase of chronic sadness. And this is the type of sadness that's impacting the ability of our kids to interact and be active in their lives. So this is very serious. And this trend up is of much concern to all of us. And you see it for grade 7, 9th, and 11, which is how the survey is administered. And again, this is all of California, and the data is true locally. We also know that suicide contemplation is another important thing that we have to be aware of. We have to be talking to our kids and our girls when we see symptoms of sadness from them and asking them those really difficult questions. And this shows us a trend that there is some decrease, but something we really have to be cautious about. And then cyberbullying. Our kids are telling us that this very much is something that happens to them and is impacting them. And look at our younger kids. This is grade 7, the blue line. It's really very impactful for our kids. This is not divided by girls versus boys. It's just giving us a general trend. Another very reliable source, and this is national data, is the Youth Risk Behavioral Survey. Again, this is a data source that policymakers go to. This is how decisions are made. This is how funding is determined. And this is trend data for grades 9 through 12. Twice every 2 years, kids are asked these questions. It's a very large sample. And like I said, it's used on a national level to make decisions. So let's dive in very quickly to this data because it does give us some information about boys versus girls. This is talking about how many high school students feel sad or hopeless. And again, that sad and hopelessness that's elevated. And look, even though we looked at the suicide data and we saw less girls have died of suicide, they are feeling sad. and we need to pay attention to that. This is the trend data, and you see that increase. This is, again, this is beyond just California. This is throughout our nation. And then what you see in this slide is that in California and some of the other really states that have that darker blue, we're seeing higher rates of this sadness and hopelessness. So we have a lot of work to do. Then we switch to those kids who have seriously considered attempting suicide. Less kids, but still, look at those rates, 24% of our girls nationwide. And again, that trend line that's showing us this is a persistent issue for our kids. And again, in California, this is very much a real issue for all of us. Looking at it even another lens, students who made a plan about how they would attempt suicide, that's that next stage. 19, almost 20% of girls have expressed making a plan. Again, that trend line that we see across our nation. And then we see that in California, this is something that we have to keep working at because our girls are suffering, our kids are suffering. Then we've got those who've attempted suicide. Again, more girls than boys, even though we looked at our local data of kids who've completed suicide, they are attempting suicide. So we have to be watching, we have to be diligent, and we have to have programs, parents that talk to the girls and the boys about this. And then we see the trend line, it is persistent. And then we see where we fare within the nation. And we do a little bit, we have a little bit lower rates than the rest of the nation in this area. And then this is the last kind of level of the girls and boys that who thought about suicide, they've attempted suicide, and they've resulted in injuries to themselves that needed intervention. Again, 3.3% of our girls fit into this category. And then that trend line that we're always watching. And then how do we do as a nation? So now just looking at our local data, same survey, the Youth Risk Behavior Survey, just to highlight for all of us that this data really does reflect what's happening in San Diego. And here you see the data specific to San Diego Unified. Same trend line you'll notice. And in this particular slide, we also wanted to highlight that our LGBTQ youth are very much vulnerable to feeling sad and hopeless and suicide risk. So if we are working or have a daughter that is talking about her sexuality, being especially tuned into the risk factors. So professional journals also highlight this trend. They talk about the increase in teen suicide. They also, in feeling of sadness and major depression, and they also talk about how it is much more pronounced for girls and boys. So at this point, I know that was a lot of information that I just really wanted to anchor us, but let's spend a little bit more time hearing from Dr. Vlegels, who is the supervising psychiatrist for behavioral health for children and adolescents, who's really going to talk to us about the impact of COVID, the preliminary data, and then most importantly, what do we do about it? Dr. Vlegels?
Thanks so much, Yael. So as we leave that last slide, I just want to highlight for you what I think is of critical importance to your girls. By mid-adolescence, girls are twice as likely to struggle with mood disorders than their same age boy peers. And knowing that there are major differences between boys and girls when it comes to the prevalence of mental health diagnoses, I wanted to go through and review the emerging literature on the impact of the pandemic on girls. So the first thing to note is that while the scientific literature is becoming increasingly available, essentially all articles highlight the need for continued exploration and research. The second thing to note is that my review of the literature literally pulled articles from all over the world: China, Bangladesh, the Netherlands, Australia. And it's important when reviewing that literature that the government responses varied significantly between these countries. So it's not necessarily easy to extrapolate the information from those articles to our own kids. I mean, even here in the US, the state government responses varied vastly. And I know when I compared my kids' California interventions, they seemed night and day compared to what my best friend and her children were going through in North Dakota. So with that all being said, I did find one article that teased out the impact on girls specifically. And this study came out of New South Wales, Australia. I want to spend a few minutes on this study and results because I really think the information could impact you and the work that you're doing with your girls. So in New South Wales, there's a research group that had an existing study where youth had been completing an online questionnaire annually for the past 4 years. And included in that questionnaire were questions pertaining to depression, anxiety, and life satisfaction. So when the pandemic hit, they again surveyed these youth and added questions about schooling, peer and family relationships, social connection, media exposure, COVID-related stress, and adherence to stay-at-home orders. And they gave this second survey 2 months after the implementation of government restrictions and online learning. They found that overall, adolescents experienced a significant increase in depressive symptoms and anxiety, and significant decrease in life satisfaction. The factors that produced the greatest distress were not being able to see their friends, having a sick family member, and not being able to participate in their extracurriculars. But this study opted to look at the data between comparing boys and girls, and they found these changes were particularly pronounced in girls. So girls relative to boys experienced more depression, more anxiety, and the girls' life satisfaction decreased more than that of the boys. So why might that be the case? Remember from Yale's slide that there's well-established literature that there's a difference in the incidence of depression and anxiety between adolescent boys and girls. But I think it's even more compelling to consider typical adolescent development for girls. Girls are much more likely than boys to rely on their social networks for support when dealing with significant life stressors. The transition to online school and other restrictions may have effectively taken away girls' ability to use their most common and best coping strategy. The authors of this study suggested that for this reason, it may be particularly important to encourage adolescent girls to connect with their friendship groups via safe means, of course, so they can continue to access their support systems. So knowing that some youth are struggling and that girls might be struggling more than boys, what can we as parents and caregivers do for our kids? So thanks. So people frequently talk about the need to be resilient in the face of a major stressor. And what I want to share with you all today is the good news that resilience is not a static factor that you either have or you don't have. There are several factors that go into a resilient mindset, and there are specific actions you can take to address each of them. I really like this graphic from Harvard University that shows the interplay of factors we are going to discuss today. And as you can see, it's like a seesaw. On one end are negative outcomes. And for our kids, that might be closed school, having a sick loved one, there being a job loss in the family. And when that side of the seesaw gets too heavy, it can push somebody into darkness or despair. On the other end of the seesaw, we see positive outcomes that can help lift one up. And so for kids in the pandemic, this might be the fact that they've got more time with family members. The final component here is the fulcrum itself. And having a stable base is critical for a seesaw. And if you remember back to your days in physics, where the fulcrum is located can have an impact, the likelihood the seesaw is going to tip one direction or the other. So let's go to the next slide. So to improve our kids' resilience, we first have to unload the negative side of the seesaw. We have to make sure that basic needs are met. And as parents and caregivers, we must take advantage of all supports that are made available to us. none of us can manage alone. Managing expectations can also mitigate negative outcomes. And this has been really helpful in my household with my 11-year-old twins. We've really moved to a mantra over the course of the past year that done is better than perfect. Finally, ensuring that as parents and caregivers, we're modeling self-care, we can really prevent ourselves from spinning out in an unhealthy manner. Next slide. Thanks. Next, we have to load up the positive side. Here, I want to focus on the importance of friendships and connections for our kids. We know that resilient children are more likely to have a stable, committed relationship with a supportive parent, caregiver, or other adult. So if we bring forward what we learned from the New South Wales study, that girls are struggling more with depression, anxiety, and have lower life satisfaction as compared to boys, and that one of the primary contributing factors is not being able to see friends, I think we can all agree that fostering these connections is critically important. Next slide, please. Thanks. Finally, we need to attend to the fulcrum, that supportive base. For kids, this is all about safety and security. And while masks and physical distancing are important for our physical safety, having structure and routine will contribute to emotional security. Kids thrive when there is predictability, and that can come within an individual day, like having a good bedtime routine, or over time. For example, having some set family holiday traditions to look forward to and celebrate, or you can develop new routines to bring in some fun and creativity. In my house, our Sunday routine has evolved to include baking homemade bagels, doing jigsaw puzzles, and listening to classic country music, none of which I can assure you we did pre-pandemic. And although I referenced self-care earlier, I can't emphasize enough that being well-rested, having some type of regular exercise, and implementing self-regulation strategies are the true building blocks for resilient kids and parents. So I'll turn it back to Yale, who will share some local resources for you all.
Thank you, Dr. Vogels. So we did include for all of you this handout that comes from the San Diego County Office of Education. Within it, there are so many helpful links. You can share it with the students or the kids that you work with, or you can share it with the parents for them to pull information. It's just really worth looking at. And we pulled some of those resources to talk about. So for example, one of the handouts embedded is a young person's guide to wellness. It actually gives links to videos for wellness for younger kids. This is like pre-adolescents. It also gives links to apps that the kids can have access through, either through a device they use or a parent's device, that really helps them self-regulate, which really fits with what Dr. Vogels was highlighting, the importance of just creating kind of like learning to be in tune with their body, being in tune with their breathing, giving them different exercises, getting their body moving, making sure they're sleeping well. Those are all really critical things that our girls need. And you see it here also, which is part of the handout. Routine, routine, routine. It is so important. Asking our girls questions. How do you feel? If they're being quiet, having those routine around the dinner table where you exchange kind of the best thing about your day, the hardest thing about your day. Any way you structure it as a family can work. Being active. And we'll give you some other links to YouTube channels that get kids moving in different ways. And then really making sure that our kids are self-regulating, staying connected to what's happening with them. I don't think we touched upon this yet, but device management, making sure that our kids, when they go to bed, hopefully their devices are outside of their room. They're not going into the room with the devices where they're on them all night long. We know that doesn't help kids self-regulate. We know it's important to take them out. In my house, we have 3 boys, so we do Boy Scouts. We have a time at which they turn in the device. It doesn't go in the room after that time. It gets turned off. and I have a 14-year-old, a 16-year-old, and an 18-year-old. The time in which they turn in their device is different based on their age. Quite frankly, my 18-year-old doesn't turn in his device anymore. That's done. But really tailoring what you do with your child, because you know what your child needs. And especially if they experience any type of bullying on social media, then you intervene as appropriate with your girls for your family. The last thing I want to highlight is this website. This is a website that Health and Human Services put up as the pandemic was impacting all of us. It is really excellent. It is worth going in and visiting. In it, there are these tags such as the toddler and children, elementary school, middle and high school. It also has ones for parents and caregivers, one for older adults. And again, embedded in there, there are stories, there are links to different exercise routines. It's just really full of different information that's worth looking through. The rest of the slide set are just available for you to look through and know that it's there. But at this point, I think we'll stop and take any questions you might have. So I'll turn it back to Carol.
Great. Elizabeth, have we received any questions? And if Allison, you can move us back to the slide presentation.
And thank you, Carol. Actually, we have no questions on the chat space at this moment. I did, if we can we go ahead as part of the slide deck, flash your contact information, Dr. Yale and Dr. Laura? I know we're going to share the slide deck, but sometimes just right after we get off the camera or later on, folks just want to touch base with you directly. It's always great to have, and I think it's the last slide under questions on your slide deck. We'll get it to you, and if not, the HHSA team can add it to the chat.
Wonderful.
How's that?
That sounds great. That's great. Well, thank you so much, Al and Dr. Weigels, for setting the stage of why programs like Girl Scouts are so very important to our girls and the impact that all of us can have throughout their lives. This is also why it is so important for Girl Scout staff and volunteers to work together, to provide as many opportunities to our girls as is possible, especially given the year that we are in. And if I can, talk a little bit about where we've come just in this last month, because it's, as we all know, sometimes we don't even know what day it is, but I'll just remind everybody that the stay-at-home order was just lifted on January 25th. And we heard from many of our volunteers that you were eager to do more with your girls. So we moved quickly as we could, to schedule a meeting with the San Diego County Health Department. On February 10th, we were able to get a fantastic meeting together. And actually before that, we were sharing emails and we were getting all kinds of resources to better understand what we could and what we could not do given the local and state guidelines. The team at the county, I just can't say enough about them. You will get to meet more of them as we go through this presentation, but they are they're in it for all of us, and they're doing the best they can to make sure that we're all safe, but that we can continue forward on many different fronts. And I just feel so proud to be a part of this county because of them. And I have to say the same about my team. My team is working tirelessly to ensure the safety and well-being of volunteers and the girls, but also to be able to provide impactful programs to each and every one of our girls as best as we possibly can. And in this time right now, we have gone through so much analysis of what we're able to do and looked at things thanks to the professionals at the county who helped us to really analyze what we were able to do going forward. So without further ado, I'm going to turn this over to our Chief Mission Delivery Officer, Michelle Mullen, who's going to walk us through some of the in-person experiences that we are now opening it up. Go ahead, Michelle.
Great. Thanks, Carol. And thanks, Shael and Dr. Laura. That was fabulous. Lots of information. I'm sure there are folks who are going to go back into those slides and spend a little bit more time with them, because the data there is just so helpful and also disturbing as we think about what our really what our demand is to be vigilant around the health and well-being of our children. So a few things to start with. So those of you who are caught up on your email, I'm saying that with a smile, like I am caught up on my email. I am definitely not. But on February 24th, we sent out a communication that came from Carol that really highlighted the outcomes of the partnership that we have with Health and Human Services and Office of Emergency Services around what it is that our girls can do and what our volunteers can do. In that communication, so some of this is going to look familiar, because in that communication, we highlighted some core sort of components or factors of what it is that we were looking for. The primary reason that we are working together in this county with HHSA, OES, and us is really to focus on the well-being of our girls and all children, but for us, Girl Scouts, we're looking at our Girl Scouts. Their physical and mental health is at the core of the decisions that we're making. The other piece at the core really is having choices. So one of the things we know from Yael and Dr. Laura is that we have to find ways to have our girls be engaged, and they need to be engaged with each other. They need to be engaged with healthy activity. They need to have things to look forward to. So as we think about that, how do we offer choices where volunteers, girls, and families can enter in at the point at which they're comfortable, so that they don't feel like there's a one-size-fits-all solution for how to engage our girls, but they've got ways to enter in a place that feels comfortable and safe. The work around this, to reiterate what Carol said, really comes from having constantly the voices in our heads that come from our volunteers and our families and our girls, as we're listening all the time. What is it that they're saying? What is it that they need? What is it that we can provide that gets to those needs? So one of the things that we did, and Carol alluded to this as well, is we sat with our partners at HHSA and OES, and we looked at the guidelines that we had already sent out. And some of you asked questions about the previous guidelines that we had in terms of identifying by tier, purple tier, red tier, et cetera. What's different now in that representation versus what we had before? And this is where our partnership comes in, because what they did is sit down with us and look at what we were already setting up and having in motion, and what is it that we weren't seeing necessarily that we could do. And so they've guided us through the school guidelines and community-based youth organization guidelines, youth recreation guidelines, the retail guidelines, and particularly things around farmers markets, to help us see that those guidelines were also speaking to us and to our girls and to our volunteers, and that created places for us to offer more choices and options. So we spent time doing that. Our new guidelines reflect that. So there are some minor changes, and most of those have to do with who can meet in person and for what reason, and how many people can meet. When we're going to get into that in just a second. So those are the slight adjustments between the previously tiered guidelines that we had and the ones that we have now. Really are those tweaks, if you'll look at it that way. So Allison, if you could go to the next slide, please. So one of the things that we provided direction around, and this was an area that we know there's a lot of people on a continuum with respect to comfort, and that is meeting with other folks face-to-face outside of the house or outside of the family, right? So we looked very carefully at that, and the guidelines that we are providing that come again from the county and the state published guidelines have to do with how we structure around a cohort model. So when we think about troop meetings, and I'm going to say activities, because there are other things you can do as a cohort. It doesn't mean that you're just sitting in a circle in a park. You can go on a hike. There are things that, you can do a beach cleanup if you can do it not on Memorial Day weekend when it's wall-to-wall people, right? So thinking about the places that it makes sense for girls to be that's secure. So in the cohort model, and many of you have looked at these guidelines already, but the total size of the cohort is 16. What we suggest is that if you have a large troop, that you're obviously trying to get all your girls in to be able to participate in that, but your max is really 14 if you're going to have 2 adults at the minimum. And if you have younger girls, if you have daisies, for example, you actually need to have more adults the more girls you have. So we're going to remind you in our guidelines to follow the Girl Scout ratio, adults to girls based on level. But the size of the cohort total is 16. So you can adjust that. If you've got 9 girls and you'd like to have a few more adults, feel free to do that. I will remind you that always what we're trying to do is give space for girls to develop their leadership and themselves kind of away from some of their own parents. So you want to be careful about how many adults you put in there. I will say, though, that if you've got 3 adults, let's say, in your cohort, it gives you more flexibility with the activities you do, because when you go do activities as a troop, it's those members of that cohort who participate in the activity. All right. So it doesn't mean you all have to be together, that all 16 of you have to walk around together like this, but it means that those 3 adults are the ones that can accompany the girls in that cohort when you engage in an activity. All right. You're going to notice in our guidelines that we are stipulating that activities are outside. So it isn't a hard and fast rule that you have to be outside, but we are holding on to that as a guideline for Girl Scout activities because we are trying to maximize the highest level of safety. And the highest level of safety is to do the activities outside. And so you're going to see that we're sort of pushing you to think outside, outside, outside for every activity that you do. It's set up in our guidelines that way. The first choice for where you hold your meetings will be public locations. That's really, again, a guideline for us that actually exists without COVID. Without COVID, we're asking that you do your meetings at schools, at places of worship, at parks, that you're in places that are public. If you are somebody who has looked at those options and you're not finding places that are appropriate, then you can use the exception request form to identify that you've gone through the paces of looking for places that really would be public, and to acknowledge that there are certain safety features in your home that make it safe for girls to come and be in your backyard, for example, for a meeting. We have that as an exception because we want you to really understand and think through the safety features. So what exists in your home that you might not even acknowledge to be a challenge or to be something that could be unsafe, but turns out it could be a safety issue for a girl. So we want to run you through that thinking. And again, this has nothing to do with COVID, the idea of thinking about public locations first. This is regardless of COVID. So we're just reinforcing it as we put the guidelines together. The other thing about meeting, and this, a lot of you asked questions about this, and it had to do with how to include, if you've got girls in your troop, some of whom are eager to come together and meet, and some who are wary of that, or whose parents are wary of that. So you've got to think, for every decision of meeting, you've got to think about how to be inclusive of all your girls. So what could that look like? So does a girl bring, do you have 2 girls that can't come face to face, but you equip the girls with phones where they can be on FaceTime, and so they can be with you even though they're not there in body, right? And they can be carried around and incorporated and participate in the activities. If you're doing an activity that requires materials, can those be things that get dropped off at those 2 girls' homes, and so they can participate in those activities at home? I'm giving that as an example of how to think about hybrid. For those of you who are contemplating needing more of that, we're going to, our troop support folks and our service unit support folks are equipped and ready to help and give you some guidelines and other suggestions. There's a meeting also this Saturday for our service unit folks to come together and also think about how to provide support around troops meeting and coming together. So that's another option to come in and participate in that meeting. Another question, several questions that came up is, will we be starting to do training, or will we be starting to host activities ourselves? Will we have council-led activities for Girl Scouts right now? The answer is no, we aren't. What we're doing right now is step 1 of in-person experiences. And that means it's following a cohort model like our schools. It's very targeted in who's engaging with whom, and the groups are relatively contained. We are still in a place where we don't have large group gatherings happening in San Diego County. So we cannot facilitate large group gatherings. We, as a place of business on our properties, we are not considered an essential business to open up all of our office space and have all of our folks come back to work in the office, which means that our properties can't be open for activities that other troops can come in and participate on yet until we change our level. The one thing that we are providing, and it's an essential service, so we can provide this one, and that has to do with first aid. So some of you have expired first aid certifications. So some communication went out a little while ago about extending that for a 3-month period to give you time to be able to recertify, because you do need to have a first aid trained person with your Girl Scout activities. Our team is working on, our training team is working on securing some, bringing back some of our first aid trainers and securing some spots for doing some first aid training. And that's something that we can facilitate. They also have space, of course, to share with you the first aid training that is offered by other organizations in our community. So there are other people that can provide it too, but we will also be. So be looking for that communication coming your way. I want to remind you that we have guidelines for you to dig into the details around these things. So I've highlighted a few things here, but the details are really laid out in our safety checklist for hosting in-person meetings, the participation guidance and waiver. And I'm going to transition right now over to cookie booths to say that the review, you also want to review the standabout and the cookie booths guidelines. So Allison, if you can transition over there real quick. So by the way, in those guidelines that I just talked about, all of the social distancing and safety protocols, all of those are laid out in there. And there's suggestions, use hula hoops for girls to sit in and spread them apart on the meeting, right? Or use jump ropes to create squares or circles where girls will sit. All the safety protocols that you'll follow, including how to use what's called a safe reopening plan, those are all outlined in our guideline documents, okay? So in-person cookie booths, just a quick couple of highlights here before I transition over to Gary and Elizabeth. So some folks were wondering why we extended cookie season. So some of you might have noticed that we didn't, when we started cookie season, when we published our materials, we didn't have an end date. And that was because we didn't know what was going to happen with our county in terms of options that would open up for our girls. So on the heels of our working with our HHSA colleagues, we've learned that there are things we can do with cookies, and we can do standabouts and we can do booths, because we can control in those environments for safety features and control for distancing, numbers of girls present, et cetera. So we are extending the cookie season until April 18th as an option. So again, it's about having choice. We want all of our volunteers, families, and girls to have choices. So that means that you can opt in to participate in booths. You can opt in to continue doing cookies on your digital cookie site up through April 18th. Our booths are going to begin this Friday, March 5th. And we've got, I think, 400 plus troops currently signed into booth spots, and there are still more available for troops who want to do that. A reminder to you that, again, booths are outside, and those are all in our guidelines. And some question came up about, could there be other booth locations in a community that aren't already identified, including if there was a church or somebody who wanted to host a drive-through booth. If you are interested in sharing information about that, or you have an idea for that, you can check with your service unit cookie coordinator, or you can also go to the website, the email, cookies@sdgirlscouts.org, okay? I'm going to stop right there because we can follow up with a few other cookie questions if they're still present at the end during Q&A, but I want to give over the time now to Elizabeth and to Gary, who are going to speak to a number of your questions that came in that really focus on a sort of a higher level Health and Human Services or Office of Emergency Services perspective. So I'm going to pause right there and let Elizabeth and Gary make their entrance.
Well, thank you. Thank you very much, Michelle. You had me taking notes. Great presentation. And of course, to you, Carol, thank you for setting such a beautiful and really safe table for us to have this conversation this evening. And plus, you gave me one of the greatest treats these days to engage with Mr. Gary Johnston on Q&As. Just looking at the questions that came in, this really lets us know that, Girl Scout San Diego families are engaged, okay, and they care. And more than anything else, they care. So bringing you in, Gary, you ready to go?
Yes, ma'am, I'm ready to go.
And I know you saw the questions ahead of time in prep, and you know that there's some overarching themes. And then so right out of the gate, communication, which is really essential. So here we go. What if we have a spike again? COVID spike. Okay, science and statistics dictate that there will soon be that due to Super Bowl, and of course St. Valentine's Day, plus we got spring break coming up. What might be around the corner, Gary?
I'm going to answer that question, but before I do that, I really got to probably tell people a little bit more about who the heck I am, so that you can maybe better appreciate where I come from with some of my responses to this. But first of all, thank you for this opportunity. Quite frankly, I'm quite often on a lot of telebriefs with the job that I do. But for the record, I've been with the county for about 2 years. I just retired out of the Marine Corps after 30 years. I work for the Office of Emergency Services. I'm the Chief Resilience Officer, and I'm an agency rep out there with our firefighters and law enforcement. Then HHSA kidnapped me and I became part of the COVID response with things that happened at Miramar a year ago. I helped out with the convention center, setting that up with the city for our homeless. And then when reopening started coming with the California Resilience Roadmap, you may remember that many years ago, seems like, with the state, I got dubbed to come in here and lead kind of the reopening for the county. Don't have much of a staff. I pull folks like Elizabeth and others that work with me when I take a look at plans and guidance and get input from environmental health folks to public health to epidemiologists to lawyers, whatever it takes to help out the community, not only balancing the public health and safety with COVID, but also trying to reopen socioeconomically at the same time, a wicked complex problem, especially, I'm not bashing the state, but it's been challenging with the state. They have very, very centralized control, as you probably know, with reopening, which really causes this county some challenges. So with that, I'm very open. I'm going to give you the best I can give you in the way of how I see spirit and intent. You'll hear that a lot from me because we align directly with the state guidance. We don't do our own guidance documents that goes in between them and us. It's just too much guidance, quite frankly. LA does that. Good on them. But to me, quite frankly, it's one more layer that none of us need. And so that's why some of the guidance is a little bit broad. It's designed to be that way. The other thing I'm going to preface before I get after these questions is that I absolutely believe that everybody has to accept a little bit of risk. And when we talk about reopening or socioeconomic reopening, the state risks when they put out an industry guidance document that says, here's how you're going to reopen your restaurants. The county accepts the risk because we accept that guidance and then we push it down. The restaurant owner does it. Ultimately, I do it when I go in there to basically go to that restaurant and support it and have dinner. And so we all make choices. I think Michelle talked about choices. You all as an entity or an organization, as a parent, as a troop leader, are going to have to make some choices and assess some risk in doing so. So anyways, that's it for me, but I'll go ahead and answer the first question. And then again, as the questions come in the chat, I know our team will help bring those to bear as well. So when I looked at your first question, it's some levels, we are seeing a little bit of a leveling off in the decline of our case rates. And so that could be for a number of reasons. I think there's a question a little bit later on the special strains or these other strains of the virus that we're dealing with that could be contributing to it. We had a rapid descent. And so at some point we should expect, just like you see a rapid acceleration, you're going to see a plateau maybe happen, and maybe we'll dip back down again as we continue to get the community vaccinated. But really, we're beyond the Super Bowl. I'm not sure we're beyond Valentine's Day as far as seeing a spike in cases as related to that. But what I can tell you is that our capacity at our hospitalization, or our hospital capacity, our health services capacity is hitting on all cylinders. This county has had an incredible capacity. Unfortunately, we got pulled in with about 10 other counties during the regional stay-at-home order that kind of hurt us because we had much greater capacity than other counties that we were tied to. but we're in a good shape. We're seeing a dramatic single digit drops in our ICU requirements for our COVID patients, which is great news. And our death rates are starting to fall. This goes to the fact that we are vaccinating some of our most at risk, our elderly folks, and our first frontline workers. When you take care of those two things, the death rates and the hospital capacity, that basically means we got a really, really bad flu out there, but it's not as deadly as it once was. So the more we vaccinate, the less deadly and troublesome it becomes. So that's the first question there. I think the second one, I'll just hit it while I'm on it, is how far in advance should we be told to shut down again? This is again a one that's probably going to be condition based, but typically, folks, we will get updates from CDPH on a weekly basis. Every Tuesday about noon, every county sees exactly where they are with case rates and testing positivity and some other metrics. We will probably, as a result of that, you can kind of forecast, when you tie these weeks together, where we're headed. And that will hopefully allow you some decision space and some time to make some adjustments all the way down to your level. But I don't think there'll be a lightning strike that will say, hey, tomorrow you got to stop. I think you'll see this coming. And if you communicate with folks like us and you're involved in maybe our community-based organization telebriefs, which I highly recommend, you'll get those updates. You'll see this stuff coming routinely. So enough on that question. Hopefully I did okay, Elizabeth. Back over to you.
Yes, you did. And going back to HHSA, wasn't that you volunteering to join Team HHSA?
I think it was voluntold.
And so, and thank you very much, Team HSSA, for putting on the chat the link to the community-based organization telebriefings when having one tomorrow, 1 to 2 p.m. And we really do deep dives on what Gary was just describing in terms of, forecasted spikes, hospitalization rates, that kind of a thing. So we really do encourage you to check that out. Next up, Gary, just general information on guidelines. Cookie booths. What are the recommended precautions for troop meetings and cookie booths? Dear Gary.
Yeah, I know this one is of significance to a lot of folks for a lot of different reasons. So again, I'm going to do the best I can here. You can look at a cookie booth, quite frankly, as a retail entity, because that's exactly kind of to some extent what it is. The concern that many folks have, which would be me as well, is that you've got children out there with respect to a retail situation. So, for me, this goes back to folks like yourselves that have to come together and discuss the risk. There's not only risk just in doing this with a health risk, but there is also that optic, that socio optic of having kids out there in a particular setting selling cookies. And so all those things have to be addressed internally and then again externally with us. But I see nothing that is egregiously in violation of any public health order or guidance right now that says you can't do it. A matter of fact, over the weekend, last weekend, my wife and I were headed to go for a mountain bike ride, and there was a little girl, a Girl Scout, and her mother in the front yard on a corner with a table, with a sign, with a mask on. And I said, I have to stop. I stopped my truck. I got out, I had my mask on, and I approached her. There was a sign there for 6 feet of separation from me and the table. She had basically a jar with a slit in the top with the lid, so it was touchless. I had to either have the exact change or she got a bonus. I put the money, I asked how much it was. She's told me. I put the money inside the jar, and I had to pick my boxes out, so there was no touch. And I, quite frankly, it was beautiful. So again, front yard of a house. I'm not going to tell you where that was in case they weren't supposed to do that, quite frankly. But bottom line is, if you follow the big four, as I say, and the big four, as I communicate this often, because it's good for a dumb Marine like me to remember, the first of the big four, as I call it, is the screening piece. Mm-hmm. Your workers, your kids, your adults, screen every day. That's the questionnaire, and that's the temperature check. So bottom line, whenever a child, even if that's at school, shows up, the expectation is you have a healthy individual when you do the right screening. Number two is that we always obviously practice good hygiene and sanitation protocols. So obviously the hygiene ought to be something there at that booth. The table and everything else has been very well sanitized before you obviously execute something like this. And then the third of the big four is the face covering. They're mandatory. There's CDPH guidance out there that tells you exactly what you have to do and even how you have to wear your face covering. And then fourth is the physical distancing. You combine those four things for almost everything that you do with all the state guidance and everything else, you're in a good place. You can also, though, enhance that by being outdoors. You can increase distances. You have ventilation situations where if you increase ventilations, even on school buses, you talk about it. We can't give 6 feet of separation for kids on school buses. We don't have enough school buses on the planet to do that, or bus drivers. So you take a little bit of risk, you open windows, you maybe mitigate some of the issue. Maybe we can't go 6 foot, we go 3 feet. So I'm giving you a lot of extra information just to tell you that meet the spirit and intent, the right place, the right time. The boosts, I believe, are permissible. It's really going to be on you all on how you want to basically conduct these and where you conduct these. Next question, Elizabeth.
Thank you so much. And context is always helpful, Gary. And this next question has to do with getting back to activities in person. Just simply want to hear your guidance, best guidance, Gary, within the context of safety protocols. So when do we get to do things back in person? Any thoughts?
Yeah, and I think, and again, Michelle, you can jump in at any point in time. When I look at this document that you all put together here with this matrix, this is great work, and this is a good work by a lot of different folks. Our team has provided some input to this as well. When it comes to in person, there's a lot of things that you can do, and there's a lot of things that you can't do. A lot of times, and you've referenced meetings. And so one thing is, I'm not in the Girl Scouts. And so I don't know when you have a Girl Scout meeting, or is that really an activity? There is a difference as far as I'm concerned. I'll take you to place of worship. Place of worship is considered an essential activity, an essential entity. I tell the places of worship that you can have meetings, and you can even have them indoors if it's for an essential activity, and that place of worship considers that to be an essential activity. I recommend, however, ask yourself, can I do the meeting remotely? If you can do the meeting remotely, you should do the meeting remotely. If you can do it outside, I would suggest you do it outside. So really, you give some decision space based on the guidance, what it tells you can and can't do. So for in-person activities, we have kids are in person going to school and getting in-person instruction. We have day camps that go on right now with cohorts and stable groups, indoors and outdoors in some cases. So there is a lot of meetings of groups. The thing about the meetings and the gatherings, typically they're permissible because they're captured in a CDPH, a California Department of Public Health industry guidance document. So we can gather at a restaurant. Why? Because there's a guidance document that gives you some protocols of the things that you need to do, including the restaurant having to have an operational protocol posted along with the safe reopening plan that allows you to do that. And so that's why when you look at meetings, I would argue that when you look at some of the activities you guys are considering for our Girl Scouts, we allow day camps. Okay, so there's day camp guidance. You can actually pull the day camp guidance document, see the protocols in there, and you can align some of the things that you're doing with that. Don't manipulate the guidance, but utilize it to kind of fit the venue that you're looking at. You have outdoor recreational guidance. It tells you what you can do as campers or visitors. They use those words. And I think there's really some good stuff in there that you could leverage when it comes to an activity outdoors that you want to do. You have youth sports and adult recreational guidance. You'll see something in there about horseback riding or equestrian. So there's a lot of different guidance documents out there that you can use, especially if there's not a set guidance document that fits the Girl Scouts and a Girl Scout activity. You're going to have to use other ones. And that's why you have the cohorted guidance. We put that out there. You can utilize that so that you can have that stable cohort. There's also what they call a stable group. We can talk about that a little bit later. That's actually in K through 12 guidance for your secondary schools, because we all know we can't really reopen more broadly with our secondary schools and keep our classrooms to 16 students. It just won't be feasible. So the state has opened that up. A stable group is a little bit bigger with some of the same type of mechanisms. So that's probably enough on in person. I may not answer all your questions, and maybe I'm generating more, but I do believe these type of activities are permissible. It just really depends on the activity, the setting, and the venue. And I'm always happy to help you all out to try to make sure that maybe you're on target. So anyways, Elizabeth, let's keep rolling. I know we got a lot of questions.
Got to roll. Thank you so much. And Gary, just transitioning to some specific activities. And thank you for the team for putting on the chat, the guidance document links. So I think I heard you mention equestrian. And so question came in about, can we do a troop activity such as horseback riding at this juncture?
Yeah, and again, I did put that down there. I would go again to the outdoor recreational guidance on how you do things like that. Because outdoors, quite frankly, I was talking to Dr. Wooten. I said, hey, Dr. Wooten, you want to join me for an hour and a half with our Girl Scouts of San Diego County? And she says, unfortunately, she's already on another call. And I said, pretty much you can do almost anything outdoors. It's kind of what she said, a little bit flippant, but that's one thing that even Secretary Galley said today in the press conference with the governor. They've learned a lot about outdoor activities. And I think in our state guidance, you're going to see them in the next few days or so expand some of the things that we can do outdoors based on the lessons that they've learned over the last several months. So horseback riding actually is listed as a low contact sport in the youth and adult recreational sporting guidance. And so you can even actually have inter-team competition with respect to horseback riding. And there's guidance in that document on what you have to do. And you know what you're going to see? You're going to see the big four, like I talked about, and a few other things in there to include maybe some parental consent and whatnot. So yeah, those things can be done. And before I forget, I'll say it now and then we'll come up to it again. If you all are going to conduct an activity, I always recommend that you have a safe reopening plan. Somebody put in there the link, which is a 3-pager. Every one of these guidance documents, and I guess I'll pull one out here as I sit there and talk to everybody. Here's an example. This is the outdoor recreational guidance document. This is what they look like. This is outdoor rec, and it's probably about 20 or 30 pages, 25 pages. Every one of these starts out with saying you have to have a COVID prevention plan. Everyone, including restaurants. So what we said is like, oh no, if we don't come up with some kind of a template, we're going to have 1,000, 1,000,000 different type of reopening plans stuck over everybody's window. We came up with that template. That template is designed primarily for retail and things like that, but quite frankly, it can easily be tailored to an activity. And so my thought is, and you can generate your own format, quite frankly, if you want to. But if I'm going to take my kids out, or I'm going to take my soccer team somewhere, my Boy Scout troop or whatever, and I'm going to go do an activity that I believe is permissible under this guidance, I'm going to actually come up with a plan, and I'm going to basically fill it all in, make sure that I've gone through all the protocols, all the requirements, so I can look myself in the mirror to say, I have done everything I can do to make this a safe activity for everybody participating. Then I take that document, guess what I do? When we get to our point of departure, I say, give a copy to all my Boy Scouts. And I say, read this, let's review this. Now everybody knows exactly what we're supposed to do and not supposed to do. Now put that in your left breast pocket and let's move out. So that's kind of another thing that you'll hear me talk about later on is safe reopening plans. Very, very important. And I think if you do that, it's a really, really good way to go.
Yes, Gary. The power of the safe reopening plan. Okay, so here we go. These are all outdoor related questions. When do we think we will be able to camp as a troop, Gary?
Yeah, so again, this is a good one. This tells you that you can actually do some camping. It talks about visitors. It talks about being with households, and so again, it goes back to the physical distancing, your cohorting group. If you're talking about the camps, like the week-long overnight, youth camps that we're familiar with, guidance is coming on that. It's sadly because I actually put I'm on like 5 or 6 different working groups. The state has sucked me in, and I'm happy to be involved because the county gets, an opportunity to put pencil to paper on some of this. I actually chopped on 1 December in great detail, the overnight camp industry guidance for the state. 1 December, they said, hey, we got to get this out. Well, it was 1 December. I'm still asking for it, and it's still working through the chain because I told them folks like you all need to plan for these in advance. You got to reserve things, all this. So again, I haven't seen it yet, but I know it's got to be almost complete. So that guidance is coming for maybe the more broader, how you're going to run an overnight camp for youth. When it comes to just going out camping overnight, I think you're out. This guidance will help you get there. And again, it's going to be you guys to assess whether or not you feel comfortable doing that with your cohort going up there, maintaining the physical distancing, the masking, all that. But again, nothing says that it's explicitly prohibited to do that. And it's designed for you guys to have, again, some decision space on how you want to do that, where you want to do that. Every campsite potentially should have a safe reopening plan. You should see that when you get up there, because they have to have a plan as well to make sure that they keep their sites also in good stead. Keep going, Elizabeth.
Thank you much. Broadly speaking, clarity on troop travel in general.
Yeah, that's troop travel is going to be, just like it is with school buses, we have assigned some way schools have basically kind of cracked the code on the school buses is they've got everything from obviously whatever separation they could get, 3 feet, they checkerboard seats, they put assigned seating and then they even put, sometimes they have bus attendants on there to make sure the kids, especially little ones, stay seated and kind of keep their mouths shut, so to speak, and try to keep some good order and discipline on the buses. So those are type of things that you would have to implement when you do drive. I would highly recommend that when you can is to keep your travel as separate as possible. Don't overload a vehicle. If you can, if households can stay together, that's great. I don't think that's going to be the case when you move out as a troop, but you want to basically spread your kids out as much as you can in those vehicles. So instead of trying to take the 7-seater SUV or the van, you might have to take the van and you might have to take somebody else's car and spread the kids out to the greatest extent possible. But then maintain everything else we talked about, the face coverings, and make sure that, again, everybody's screened before they get there. The vehicles are highly sanitized and everybody else is sanitized. So as soon as I get screened, as I walk up there, the next thing is I'm getting screened, I'm getting a squirt of hand sanitizer in my hand. The place should have already been sanitized. So not only do I have, I think, a healthy a youngster, I'm also got clean hands now. So wherever I came from, my hands are now clean. I've got the face covering. If I forgot it in the car, I'm getting another one. The face covering is on. And then obviously there's plenty of things and people there to make sure that I maintain 6 feet of separation. If I can't get 6 feet, I'm 3 feet because I'm inside a van going to a location. Get the windows down, get the ventilation going, make sure that everything else is in place. And I think you'll be in a good place.
Wonderful. Thank you, Gary. And just you woven response to this throughout, I believe. Can you just affirm recommendations for in-person meetings?
Can I confirm recommendations for in-person meetings?
In-person meetings.
I think I've hit it as much
Yeah.
as I can. I mean, like I said, these are, what we are expecting to get here pretty soon. And it's another industry guidance document that I put some input on, is private events and conventions. And that actually is going to be a combined industry document, supposed to look like this. Should have been out 3 or 4 weeks ago, quite frankly. And it's going to really help out our hotels when it comes to the meetings and small conventions. And they break it down in certain sizes and shapes and stuff like that. So that guidance is even coming to allow hotels to actually have regular type meetings, because they really desperately need them now that the tourism is dried up. But I do often get calls if they're going to have an essential meeting of essential workers or things like that. Those are permissible. If they have any questions, they usually reach out to me. But if it's like a hands-on prac app for some medical or some technicians and they need to come in there and touch the stuff, that is permissible. But I say the same thing. If you could do this meeting remotely, do it remotely. And that's what the hotel needs to ask the entity that wants to come in there and do this meeting. Why? And if they have a good reason, it's hands-on practical applications for certifications, it's for testing. Those obviously make the cut, and those are permissible.
And thank you very much. And this next is really not a question, more of a statement. Somebody who's really doing their homework. Thank you very much. The wilderness hiking and backpacking volunteers are committed to getting the girls and adults outdoors in the safest way possible. This is what this conversation is all about. We have developed best practice protocols for our group and would appreciate any input from HHSS, of course. And you will be sending this out through Michelle and company. And this is really the invitation, open door policy for you as you develop your plans. As Gary is stating, send it in to us and we will pour over it and we will have conversations and we'll just shepherd you through it. So thank you for that. Gary, okay, California released new guidelines, I think maybe in the last week or so, on youth activities. Hiking is considered a low contact outdoor activity allowed in the purple tier. Assuming we follow state, county, and Girl Scout COVID guidance, what are your thoughts on resuming the council wilderness hiking program, dear Gary?
Yeah, first of all, I think that that youth and adult recreational sports guidance document that you are talking about is going to be refreshed. Matter of fact, I believe I got a draft confidential embargoed copy from the state before this call, primarily because I think many of you folks are probably tracking the Superior Court decision on youth sports. They came, settlement was made today. I can't go into the details of that, but bottom line, the result was that the CDPH is going to basically had to update their guidance. And so they did that. I've got a draft of it. But nobody told me in the email when it's going to get released to the public or anything like that. It's typical. We got something, but we don't know if we're supposed to provide input. I will always do that. So anyways, be on the lookout for that. And again, if you're plugged into some like our CBO meetings, we'll review those guidance documents when they come out so that everybody kind of knows how to interpret them. But I think you'll see some of this very, very similar things that you currently see in the most updated draft, which I guess is dated around 26 February when it comes to some of those type of activities. So wilderness hiking, if you look at hiking and things like that, even with the other industry guidance on outdoor recreation, it talks about, again, things that, that those are permissible type activities. Where the challenge comes in again is, hey, I'm taking now a cohort out there. It's not just my wife and I, it's not just the household, it is the cohort. But then again, I remind everybody that, soccer teams, football teams, tennis teams, all those teams of those youth come together and they basically conduct activities outdoors. They've been doing it for months and months. So I would suggest that something like you're talking about is probably more controlled than it would be doing some soccer drills where kids are going to be bumping into each other and coming in closer proximity to one another. So I think, again, as I talked about before, this is going to be a call that you all will have to make at the organizational level down to the individual level, the safe reopening plan on how you're going to do these. And I would say that depending on if it's maybe have one that's refreshed for every type activity, because you want to make sure that, it is a fresh document. Follow the outdoor recreational and look at the youth sports guidance. All those things in there give you all the potential protocols to take a look at, and you can pull those right into that safe reopening plan. You can cut them and paste them. That's kind of what they're designed to do. We talked about the big four. That you need to go through that routine every time as your kids come together and as you prepare to execute the event. So I think that's kind of what I've already been talking about. So I think in regards to your wilderness hiking program, I know that, Michelle, you guys had maybe some thoughts as far as this independently, and I don't want to step on any of that. Is there anything else that you guys wanted to add to that particular question?
So the only thing I would reinforce right now, and thanks, Gary, is we are calling this place that we're at right now, in-person gatherings, step one, because our goal is to help sort of socialize this idea with our families, our volunteers, and our girls about how to do troop meetings safely, how to handle standabouts and cookie booths safely, and get those big four down so that they're easy and it's like second nature, as you just described, Gary. And then that gives us space to be able to start looking at what other things can we offer in terms of guidelines and suggestions. As a troop, if you opt to do an activity like hiking, you're fine to do that. You can do activities like that. You don't need to wait for us as a troop for you to take step and action in participating in activities like that, as long as you're maintaining the safety protocols that Gary is reinforcing over and over again. As a troop, as a cohort, you can do that. So what we're going to be providing more guidance for is if we expand beyond that cohort group, what does that look like? Right? That's going to be a later step. Right now we're in step 1, just focus within the troop and what is it you're doing, and let's have success there, and let's help our public, our communities, and our families and our volunteers all feel good about what they're seeing with Girl Scouts out and active and in the public.
Thank
Perfect.
you. And thank you for that, Michelle. And I think this next one may be a team response as well. And you've been weaving your responses already. This is backpacking. Okay, it involves small, stable groups of older girls and adults eating, sleeping, and hiking in remote settings. We have the ability to be socially distant and follow COVID guidance, including the new state guidance for travel and youth activities. Thank you for that. Our older girls and adults, especially our advanced participants, have the ability to be self-contained in the trail, if needed, with minimal or no sharing of equipment. What are the current barriers to getting the girls back on the trail? And what is the council guidance on that? And Gary?
Yeah, Elizabeth, exactly what I previously said. I should have probably said, hey, I kind of covered that, all 3 of those questions with the SRP and looking at different industry guidance to do this. And I just said, again, having an SRP for, for each and every event is probably the way I would look at things, because there may be a new child that comes in. I want to talk real quick. We got a lot of pages, and maybe we should go to a lightning round, and I might even just start ripping through these questions, Michelle, because I know it's getting late, but I'm happy to actually just read through these questions myself. Elizabeth has had me do this before, so to make sure I can get through as many as I can. But one thing I'm going to mention real quick before I forget is cohorting. And I know I've seen a lot of it on the chat as well with respect to cohorts and small groups. And hey, I got to ask everybody this question. I'm not trying to be flippant. Everybody, that cohorting is a great technique, and there's an absolute purpose for why we do it, because we do not necessarily we want to try to limit the mixing and obviously the exposure to our children and to our adults. But what happens to that cohort at the school when the bell rings at the end of the day? It goes away, right? Some of those kids are actually going to go out, and what they're going to get into is maybe a stable group, because they're going to go to the high school soccer team, which is another form of a cohort. It's a group. They may go to their Girl Scout troop at the end of the day, and they're in another group. They're going to go home and high five their brothers and wrestle around with their fathers and their mothers, and they're going to go to the grocery store, or they're going to go to soccer practice. So people need to realize that it's not a silver bullet, and that what really is important is that when the kids come back to school, or they come back to the entity, or as they get to the site for their activity with Girl Scouts, we go back through the big 4 again. They go through a screening. They go through this over and over again, so that again, when you put that other group together, you've done everything you can to make it reasonably safe for them to conduct that activity. And so you're going to have, again, choices parents have as well as kids and adults have. If you don't want to go from your cohort to the soccer team, then you're not going to be playing on the soccer team. But that's kind of the way life is working right now. And we try to keep that team as stable as we can. So I just want to make sure I mention that, because some folks think that, the cohort stays together all the time. It doesn't. And if you don't go back and refresh on all those things every day before those kids come back into that cohort, or the small group, or the soccer team, or the Girl Scout troop, that's where you're going to have problems. And again, there's always a little bit of risk in everything that we do today. So I'm going to jump through some of these things as fast as I can. And I know there's a lot of chat. I think there was somebody indicating that, hey, if we can do meetings remotely, why not do them remotely? I do know from what I hear from a lot of parents, and trust me, I get all kinds of phone calls that, my kids are basically remoted out. And we heard some of this as well, that I can't keep their attention doing certain things, and it's just not worth doing it. And so that's one reason. And we talked about this earlier with our experts on our kids and their psychological and physical well-being. So let me go into these questions. I'm going to rip through them as fast as I can, and then you guys can track the chat. I can't do both at the same time, and then we can even do some follow. And I'll stay here as long as you guys need me tonight. I'll stay here as long as there's people that got questions for me. Okay, number 4, once tent camping is approved, what are your thoughts on 2 vaccinated adults sharing a tent? That's a good question. Right now, CDC is supposed to be putting out some guidance for the world or for the nation with respect to some of the non-pharmaceutical interventions that we may have to continue or back away from once we have herd immunity. They haven't released that, but that's typically what happens. CDC will put out the guidance, it trickles down to state, CDPH puts it out, pushes it down to us. We typically mirror everything CDPH says and does, because they pretty much mirror everything CDC does. But right now, I would tell you, based on even what I hear with Fauci, once you both have been vaccinated, you still go through the big 4. And I would say that if you share a tent, that's okay. However, if you can take sleep separately, I would do that in the short term until we get better guidance on that from CDC. Okay, the next questions are about the purple tier and the tiers. What would in-person meetings look like in purple tier? I've kind of described already what they look like. Again, I would argue that, a meeting versus an activity, I'm just kind of a little bit confused. If you're considering the activity a meeting, it's like going to a day camp. That's the way I would almost maybe better reference what our youth or our children are doing with the Girl Scouts. It's more of a kind of a day camp scenario where they're going to go through and do certain activities, those type of things. A meeting to me is like I'm sitting down with Elizabeth and we're having a meeting at a table. So just make sure that's kind of clear. But the way I look at it, the activity, I've kind of covered what you can do with respect to tier purple. As we go into the tiers red and orange and yellow, you'll see some expansions and abilities and capabilities to do that as we go. And I'll talk about that here in a minute because there was a big change today on our tier system as well that I'll share with you. You'll be some of the first to hear it. Okay, what is the threshold for dropping boosts and in-person gatherings if it's not the purple most restrictive tier? I wasn't sure I understood that question, but I think I've covered it pretty clearly on your booths and the in-person gatherings. Remember that private gathering guidance does exist still. 3 households can meet together. They can meet at a residence in the backyard. It's got to be outdoors. There are some other restraints, but those households have to maintain 6 feet of separation. That really shouldn't apply too much to what you all are trying to do with your troops, but that guidance is out there when it comes to gatherings. Why is it now okay for girls to meet when the county is in the purple tier? I think the word okay is subjective or maybe an opinion. Again, but this goes back on you all to determine if in fact you believe it's okay. But I think we've talked about meetings and whatnot while we're in purple tier. And again, I just remind everybody, we have youth sports going on. We have Sunday schools going on. We have day camps. We have in-person instruction. There's a lot of things that are going on right now. And the data shows, especially with our youth, we're doing very, very well, and we're not having any major cases or outbreaks for the most part if we follow the protocols as designed. We can have meetings while I'm just going to read it because this is what's being read, and I take no offense to anything, but here we go. We can have meetings while on the purple tier that was previously deemed unsafe. Before I jump to conclusions, I will attend the meetings and listen to their reasoning. I guess that's my reasoning or our reasoning. It's just awfully coincidental that when cookie sales are low, it's suddenly safe to do boosts interacting with the public and meeting in person. We aren't even supposed to meet with people outside our family currently per SD County. Does Girl Scouts recommendations suddenly override county health guidelines? Question mark. Very confusing, very convenient. First of all, guys, no offense. Whether you guys sell cookies or not, I don't care. I really, I do care, to be honest with you, because I love kids. I got a couple of them. They're a little bit older nowadays, but I guess what I'm saying is this goes back to you all and the decisions that you're going to make in regards to doing this activity. I see nothing that is egregiously non-compliant with any guidance that I've read. I've been looking at this stuff for a year. I always tell people I'm probably one word away from getting fired because I'm trying to be as open and honest and give you as much decision space as I possibly can. I'm not going to be always correct 110% of the time. But what I can tell you is that these are some things that you have to make. You talk about, supposed to meet, we can't meet with people outside our family per SD county. I don't really know what that means. Again, there are things where you can meet. There's our congregant activities that you can have. For the most part, they fall under pre-existing guidance documents. I can have 25% of my congregation in a church inside. Why? Because there's guidance that says I can do it, and here's the protocols that I have to follow. So I think enough on that. Next
Hey, Gary,
question.
let me just step in for a second. So part of the decision making was too of the stay-at-home order. So the stay-at-home order was lifted end of January.
Great point.
Move swiftly. So that question came in before my explanation today. So we moved swiftly to meet with HHSA to kind of go through the protocols and to see what we could do. And through this, we developed the understanding of what we could do and get it out to our volunteers as quickly as possible. So that's some of the timing issue around this. It was really based on that January 24th date.
Yeah, and actually, if you don't mind for 1 second, Gary, let me throw something at you too. We have, because our council covers San Diego County and Imperial County, we have folks on that are also from Imperial Valley.
Okay.
And what we know is that we're tracking in some ways with San Diego and Imperial. We know that you don't speak for Imperial County, but are you of the opinion that we are tracking similarly enough that the kinds of things that we're talking about are equally true in San Diego and Imperial County?
Yes, I would say that because again, we align ourselves. Well, let me explain. Yes, but there's some caveats. We align ourselves almost 100% with the CDPH guidance. So what the state says and allows and permits, we don't get more restrictive. The only time we've really been more restrictive is maybe a couple areas. First was mandatory face coverings. We actually led that effort in the state, and obviously everybody got on board. We have a couple of nuances with respect to the hours of operations at the end of an evening at restaurants that we've put in place. But outside of that, we pretty much are locked, fully aligned with the state. If Imperial County does the same thing, they're aligned strictly with the state, then I would say, yes, we are very, very much aligned. But the counties and even local jurisdictions within the counties, Michelle, can be more restrictive. You guys can be more restrictive as an organization. And so that's where there may be some differences. And I couldn't speak to another county, and I would have a tough time necessarily speaking about maybe even another jurisdiction of the 16 cities in our county. Although for the most part, I do talk to them. I just got off a city manager meeting with all the jurisdictions. They pretty much align with us because we align with the state. It just makes it easier that we don't have a lot of nuances to the guidance where it really confuses everybody. It's confusing enough as it is. Okay, I'm going to keep moving out, guys. Stop me if I confuse anybody or I need to be stopped. Okay, how will this plan integrate with the California tiers? For example, if we still in purple, will this still happen? I'm going to go ahead and talk a little bit about the new tier metric that came out today. And you know what? I don't know if one of our, Elizabeth, one of our folks can go into the blueprint for a safer economy. You'll see the update, cut and paste that link in here. The update is dated, the update is 03/04/2021. And so what you're going to see, and don't read it all because the state kind of plugged in kind of a new metric and a new process of how we're going to move through the tiers. And then after that, they have all the old tier stuff in there, so it could confuse you. But what they were calling it now is the vaccine equity metric, the vaccine equity metric. And we kind of figured this was happening. And it's kind of what I said before is that we knew, I knew over a month ago working with CDPH and said, what is your vaccine trigger? And like, well, what do you mean? Well, once we have vaccinated those that are most at risk, to include those that are most likely to die from this virus, and you basically vaccinate your frontline workers, and we get closer to community herd immunity, we're not going to basically have a staggering death rate. We're not going to overrun our healthcare system. Those were the two things that caused us to lock down or basically restricted a lot of our socioeconomics. We're going to have a lot of cases, though. The cases aren't necessarily going to go away overnight. but the lethality and those type of things, our ICU capacities are not going to be nearly as affected. So what are you going to do about it? Because if you don't change the windows and the case rates, a county like ours still isn't going to be able to move maybe out of red and ever even see orange, or we'll never see yellow at 1 case per 100,000. We couldn't do that with the regular flu. How do you help us basically get socioeconomically opened? And that's why we have now what we have, the vaccine equity metric. And what it basically is going to tell you is that they have 2 goals. And the vaccine equity metric is going to replace testing positivity. That was one metric that previously we were looking at. And it's also going to replace the health equity metric. If you think about it, the vaccine equity, the equity in the vaccine equity metric is replacing that. They're still looking at 4th quartile. They're going to pull zip codes from all across the state. They make this big quartile, this health equity quartile that they look at from across the state. So they're still looking at equity. Vaccine, you know, as far as checking and seeing how well we're doing as a county or as a state with the vaccine, is kind of what we used to do with the testing positivity. We didn't have vaccines. We focused on testing. Testing is becoming less of a requirement for us. We still have 27 sites out there, and you can still get tested almost anywhere in the county, but we're not seeing the demand like we used to. Why? Because we're getting a lot of folks vaccinated. So this is going to replace that. So you're going to have the vaccine equity metric with case rates. Right now, those are the only 2 metrics that's going to drive counties across the tiered system. And I'm going to be very brief about this, and then I'll move on because I do not want to confuse everybody. You can read it for yourself. Here's kind of a graphic of what it's going to look like. You can't read that, but bottom line is the state breaks this down in 2 goals. The first goal that the state set out is that we'll have 2 million vaccines administered in the vaccine equity quartile. I know as of today, we're at 1.6 million for the state. We're not there yet. But once we have achieved 2 million vaccines within that quartile, we will basically see an expansion of the purple tier and an expansion of the red tier. And what do I mean by that? Once we get to 2 million doses administered, the case rate for purple is just going to be greater than 10 per 100,000. The case rate for red is going to go from 4 to 7 cases per 100,000. It's going to widen from 4 to 10 cases per 100,000. So we get 3 more cases per 100,000, which is going to be helpful. So that, and then the case rate for orange and yellow doesn't change. So once we do that, that's going to happen. I don't know how fast that could happen. Could happen in a couple of weeks. A lot of that's going to be depending on our vaccines and how many we get across the state. The next goal 2, is when 4 million vaccines are administered for that same quartile. When that happens, you're actually going to see no change to the purple tier. You still have to be greater than 10 cases per 100,000. The red case rate is actually going to shrink. Instead of 4 to 10 cases per 100,000, it's going to be 6 to 10. Why is it shrinking? Because they're opening up the orange tier to from 1 to 3.9 cases per 100,000 to 2 to 5.9. So 3 cases greater in orange, and actually it's going to be less than 2 cases per 100,000 in yellow. So what it's doing essentially is it's spreading out and opening up your less restrictive tiers as you go from 2 million doses administered to 4 million. That's probably enough. I will tell you that the way this will work, every Tuesday, the state's going to come out and tell us where we are with respect to this new metric. As soon as we as a county basically hit the red tier requirement, they're going to tell us that. And we're not going to have to wait 2 consecutive weeks. What I'm being told in this document says right here that we will basically be told on a Tuesday that you're there. On Wednesday, we'll be in red tier. You'll be able to start opening up more socioeconomically for indoor operations for our restaurants, bars, or bars is not permissible. Restaurants, movie theaters, things like that will get 50% retail. All those things that are under red tier will happen. So that's really quick on the tiered system, since that was part of that question. You're pretty much some of the first folks to hear it. And if you've got questions, you can come back to me here later. I got to keep moving because I know.
Gary, real quickly, if you don't mind, let me just get clarification on that. I think you just alluded to it, but let me recap it and see if you've got it right. That the vaccination, the vaccine equity metric it will be the thing that triggers what we're in terms of purple, red, et cetera. But the guidelines for what you can do in red and what you can do in purple and so on, those things are staying the same. It's just those things get to open up as of right now.
Yeah, as of right now, they're going to stay unchanged. But again, what was also indicated to us, and it even says it in this document in the update, it will tell you that they're also going to be expanding some of the industry guidance that's out there. So I think you will see maybe some expansions of things, maybe greater capacities in certain venues or certain businesses, certain sectors. I don't know what that looks like, but I have a feeling it's going to come pretty fast and furious, and we'll try to keep everybody up to speed as best we can. But yeah, so right now, yes, but I think you're going to see some changes there too. And that's why, again, tune into the community-based organizations or our K through 12 sector, whatever it is. We'll provide those updates on a weekly basis, and our website will do the same.
Great. And then Gary, I'm going to ask you if you wouldn't mind, look at the questions that you have and see if there's one or two that seem like they're really important because they're different from what you've already said.
Yeah.
And let's see if we can go out on that. We can kind of wrap that, and Carol can take us home just on time.
Yep. Yeah, man. Okay, I'm looking. Just give me a couple seconds. You talked about Imperial Valley, streets and puppeteer. I guess there's one question here, and it says, at this time, while in the most restrictive purple tier and given current health order in San Diego, please, all caps, advise against Girl Scouts selling cookies publicly. So again, there's some stuff in here that, is from some of your folks that are maybe concerned and maybe want to talk more about it. And I guess the reason, because somebody is kind of saying, hey, maybe we shouldn't do this. It's kind of like with the school and the school districts and the school boards. The last place I want to be, or the county wants to be, is in between parents, a school board, and a teachers union. Okay. And so what we try to do is stay in our lane and talk public health. When it comes to the process and procedures on how you're going to implement a lot of things that you're going to implement, it goes back to the existing bodies that you have, the processes and procedures you have to come together, discuss these things, and make informed decisions. Kind of what you guys have already been doing to get to this. That's the way I would recommend you continue. And that answers kind of that, gets after that question. Cohorts, number of girls. I think we've talked about that. Stable group. If you go to the K through 12 industry guidance, and we can put that guidance on a link, you'll see where they talk about stable groups, because right now you're indicating we want to stay with the cohort guidance. That limits you to obviously 16 and 14 and 2 or a variation thereof. At some point, you might want to consider the stable group. It would be a larger group. But again, that's something else you consider, and you can see some of the guidance in the K through 12 sector guides that talks about stable groups, and maybe you could take a look at applying that. I think that covers that. Meetings, environment, location, private homes. I would recommend, like you've already talked about, stay away from the residents. Right now, we've actually seen a lot of cases kind of pop out of residences. To be honest with you, I think you're in a better place if you go with the public spaces like you've already talked about. And I'm on the last page of the questions. Let me see here. Yeah, you had specific COVID stat questions. Yeah, I'm not the public health guy when it comes to reasons for the case rates going down. Do we expect the UK variant to become dominant? We're tracking those variants, put it that way. And we're looking at that. Some of that is part of the states and our calculus on whether or not they're going to basically release updated guidance, expand things. We are seeing a little bit of a slowing of the curve, but right now I don't have any more really specifics I can give you on that, except that we track it. We do have a COVID website, and it's called the COVID Watch. We can put a link in there, and you can check that thing out daily. That's like a dashboard, and you can see exactly where we are with all of our case rates and a bunch of other information. If that's something that concerns you and you want to review it, we'll get the COVID Watch link in there as well. I think that's it. I know I went fast and furious. I may have generated more questions than answers. Michelle and team, I'm willing to come back to you. I may be a little bit off target now and again. And if I am, I'm not trying to mislead anybody. I'm just trying to give you guys as much information as I can so you can make informed decisions, bottom line. So back over to you, Michelle or Elizabeth, and I'll go to mute.
I'll toss it.
Gary. Go ahead, Elizabeth.
Well, just really quickly, thank you, Gary, for previewing what the new metric We'll be doing, everybody, a deeper dive on this tomorrow at the CBO and many, many times over, along with deep dives on all things vaccination. If you can't make it tomorrow, reach out to us. We'll send you a recording of the session. Tossing it back to Michelle and Carol.
Yeah, thank you, Elizabeth. So I just want to answer one quick question that came up. It was a thread that was playing out. It has to do with summer camp. So I do want to tell you that information around what's going to be offered for summer camp, our goal is to have it out by the end of March so that you've got access to that information. We are still in the process of deciding exactly what we can offer as these guidelines have shifted and so forth, and what we can get permitted to do. And so we've been trying to hang on and get as much current information as we have, as we can, so we can make the most options available under the circumstances. As Gary said earlier, the residential part is very up in the air. We don't have guidance for residential. Putting a whole bunch of girls in a cabin together and spend a week together in the mountains, as beautiful as that sounds right now, there's not the guidance driving that yet. Yeah. So more to come on that, but we will be putting things about camp out by the end of the month. That is our target. So I'm going to pause right there. Gary, you were going to add something.
I just, because there was a question that someone's asked a couple of times and it hasn't been answered. So I'm going to hit it really quick. And it's about being able to, hey, can I swap out my adults, maybe having a different adult the next time we go out? So that's kind of what I talked about, that your cohorts, they do break apart and they come back together. Another decision that you'll have to make. The guidance really wants you to keep that cohort or that small group as stable as you can, which would include the same 2 adults over time. But again, understand the cohort or the group disintegrates after the event and they come back together at a later time. So you've got to go through all those protocols again anyways. So again, that's some flexibility that you have. That's a decision you guys have to make, but I think you can make it safely. Sorry, I just want to make sure that person's question was answered because it came up a couple of times.
Yeah, it did. Thanks for catching that, Gary. That was great. Carol, you're going to close us out?
To close us out. Well, first of all, thank you all for joining us tonight. And again, for providing the questions that helped us to format the content of this very important conversation. If we didn't get to your question, if there's further questions, please don't hesitate to reach out. We are putting up the information as quickly as we can, doing the FAQs. We'll be posting this recording and putting that out as well early next week. So please look for that. Please help me thank the amazing speakers that we had today. Yael Koenig, Dr. Laura Blagel, sorry, Laura, Gary Johnston, Elizabeth Bustos, and their teams for the heavy lifting and the long hours they have been doing since last year. If we can all just take a moment and think of last March, what these individuals, these professionals have gone through to get us to where we are right now, having this conversation and having the ability to open up these experiences to our girls and to our families. So if you can help me to appreciate these wonderful, very caring adults for making this possible for all of us. And thank you all for doing that. I also want to thank my tremendous staff for all the work that you are doing to try to bring this information to life for the volunteers. And for those that are on the call, helping to navigate all the questions, the chat, keeping the PowerPoint going, managing, people coming and going throughout this conversation. Special thank you to Sandy and Allison, Lori, Sandra, Ann, and a special thank you to Michelle Mullen. She's, as you all know, she came on board the beginning of January, hit the ground running, and is just fully vested in and has been fully vested as a volunteer first, and now as a staff person, so committed to your safety and the safety of our girls and our staff, as well as providing the amazing experience that Girl Scouts can provide and the experiences that we can provide that are long lasting and will help them throughout their lifetime. So again, thank you all for joining us tonight, and have a wonderful evening. And again, stay safe. We're all in this together. We've got this.
Thank you, Carol. Thank you, everybody.
Good luck, everyone.
Bye-bye.